It doesn't seem to be causing too much distress by me pressing on it. And
Third-year medical student Kulveer Parhar is getting a more hands-on experience at Royal Inland Hospital than he might in the Lower Mainland.
There's not as many learners around. There's 4 of us medical students here this year, and usually there's only one of us on a particular service at a certain time, whereas in Vancouver they have multiple students. And next we'd also listen for her lungs as well, just to make sure that there's some air entry.
He's one of 4 students in UBC's Southern Medical Program who has been training at RIH for the past year, the pilot year of the project.
We really feel it's been successful because we have about 100 physicians now involved as faculty. Prior to that, we had a relatively lower number.
It's moving along nicely.
Schumacher says the program is a small piece of the puzzle in terms of solving this area's doctor shortage.
Increasing the teaching culture in Kamloops brings more and more students here, and studies show that students, when they study in places, they sometimes will decide to come back.
Yeah, okay, so
Christy Cho is one of those students who hopes to be back when she has her MD.
Most certainly I would be encouraged to practice here. What I've really enjoyed about my rotation certainly is the people. I mean, the site directors are great, they're so personable, they're here for us.
so the ligament.
Starting in September, there will be 6 medical students permanently settled in Kamloops year-round, a positive thing for the hospital, according to Dr. Trent Smith.
And then if we were going to examine her abdomen, what sort of things would we be looking for there? I think having learners around in general is a great experience. They often push you, or they'll ask things in ways that you hadn't really thought of maybe ever, or certainly for a while. So it's always a bit of a new feeling in terms of what happens at work when you have students around. Fold them up a little bit.
Having students around is also growing on patients in Kamloops.
The patients themselves have been really good because we're sort of trying to change the culture here at the Kamloops Hospital in terms of having students involved in the care of patients. Centrally, she looks well perfused.
The hope is that one day this baby won't have problems seeing a doctor thanks to this program. Tara Gostelow, CFJC News.